Imagine a world where we could detect a debilitating complication of diabetes earlier and more accurately, without causing patients unnecessary pain. That's the promise of a groundbreaking study presented at the RSNA meeting, which reveals a game-changing approach to diagnosing diabetic peripheral neuropathy. This condition, affecting up to half of all type 2 diabetics, often goes undetected until it's too late, leading to severe nerve damage and a diminished quality of life. But here's where it gets exciting. Researchers have found that multiparametric MRI, combining diffusion tensor imaging, DTI, and T2 mapping, significantly outperforms traditional single-parameter MRI in identifying this silent threat. Dr. Eun-Sun Oh, lead researcher from Suncheonhyang University Seoul Hospital, explains that current diagnostic methods like nerve conduction studies and electromyography are not only uncomfortable for patients but also lack sensitivity. This is where multiparametric MRI steps in as a potential game-changer, offering a non-invasive and highly accurate solution. The study, involving diabetic patients with and without neuropathy, as well as healthy controls, demonstrated that this advanced imaging technique could enhance the way we assess peripheral nerve health in diabetic populations. Here's how it works. The research team measured specific parameters: fractional anisotropy (FA), axial diffusivity (AD), radial diffusivity (RD), mean diffusivity (MD), and T2 relaxation time at the tibial nerve in the calf. And this is the part most people miss. While fractional anisotropy alone showed impressive diagnostic performance, AUC equals 0.85, combining it with T2 relaxation time in a multiparametric model skyrocketed accuracy to an AUC of 0.91. This means the combined approach not only detects neuropathy more effectively, but also identifies early microstructural changes in nerves, even before symptoms appear. But here's where it gets controversial. While the multiparametric model clearly shines, the study also highlights that not all parameters are created equal. Axial diffusivity, radial diffusivity, and mean diffusivity fell short as standalone markers, raising questions about their individual utility. Is it time to rethink how we approach diagnostic imaging for diabetic neuropathy? Could we be overlooking the power of combining structural and pathological markers? Dr. Oh's takeaway is clear. By merging fractional anisotropy, a structural marker, and T2 relaxation time, a pathological marker, we achieve the highest diagnostic accuracy. This approach not only promises earlier detection, but also opens the door to more personalized and effective treatment strategies. But what do you think? Is multiparametric MRI the future of diabetic neuropathy diagnosis, or are there still hurdles to overcome? Share your thoughts in the comments. Let's spark a conversation that could shape the future of diabetes care.